Dana, your nurse educator from El Paso Emergency Room. Today we're going to be going back to basics on doing a 12-lead EKG. So why is EKG placement so important? Well, improper placement can lead to false diagnosis, misinterpretation, and potentially harmful clinical decisions for your patient. Ensuring proper placement is vital for best possible patient outcomes. So let's get started with the chest leads. V1 will be going in the fourth intercostal space on the right side of the sternum. To get to the fourth intercostal space, feel for that sternal notch there. Go to the right side, and that's space number 2. Go down to 3 and 4 and place right next to the right side of the sternum. That's going to be your V1. V2 is going to go in that same fourth intercostal space, but on the left side of the sternum. Right there. Now go ahead and skip V3 because there's no anatomical location for V3. Go straight to V4 at the mid-clavicular line all the way down to the fifth intercostal space. It usually lands at the nipple line for men. If you have a female patient, go ahead and use the back of your hand to gently lift the breast up so you can get as close as you can there to that fifth intercostal space. That's V4. Now you can go back to your V3. V3 is going to go between 2 and 4 in a curvature line kind of hugging the heart there. Right there. That's V3. Please don't put V3 over here. It should not cross over V2. Next, V5 is in the fifth intercostal space, anterior axillary line. So if you have your anterior axillary line, come all the way down over here to that fifth intercostal space. And last is your V6. V6 is mid-axillary line, fifth intercostal space. If you have your patient's arm here, you will not see V6. They have to move the arm out of the way. But it stays in that same fifth intercostal space there. That's how you do your chest lead. So for the limb leads, stick to the forearms and the lower legs. Placement sites should be away from large muscle groups, such as the biceps, because muscle activity can generate artifact. The placement should be uniform, so for instance, don't attach an electrode on the right wrist and the other one on the left upper arm. Some general considerations: remove excess hair and oils to ensure a good electrode contact. You can use alcohol prep pads for oils and razors for excessive hair. Maintain patient privacy by closing curtains, having visitors leave the room for the procedure, and using a sheet to drape the patient. Ensure the patient is comfortable and relaxed, and place them in a supine position if they can tolerate it. For women, breast tissue and implants can affect the electrode placement, requiring some adjustments to ensure accurate readings. And lastly, remove cell phones away, as these devices can also produce interferences with the readings.